Great. Well, so thank you very much for inviting me here to speak today. As Jenny said, I'm going to be talking about a project that we at the Ada Lovelace Institute have been working on for a number of years now, where we undertook an ethnography into the use of data analytics systems in a local authority. So we undertook an online ethnography in 2020, working with a local authority in the UK who was at the time using predictive and synthesizing analytics. So we looked at the use in children's social care of both synthesizing analytics, so to bring together information about individuals or families from a number of local authority data systems, and bring them together into one single summary document to provide to caseworkers, to give them information about, or to give them as much information as possible held by the council about an individual. They were also using predictive analytics, which Jenny's already talked about, aiming to provide risk-based alerts about children who are expected to step up in terms of their need and the particular services they're expected to require, and also to step down. And because we were doing this ethnography in May to September 2020, we also looked at a module that was spun up very quickly in response to COVID-19. And this module, rather than looking at predictive analytics or using synthetic analytics, it used a simple filtering system to prioritize individuals for outreach from the council, depending on their COVID-19 risk factors. So we go to the next slide, please, Phil. So our research was done in 2020, but we are expecting to publish later this year a research report which articulates our findings from this research in ways that are useful and relevant in 2023. As we're all aware, the interest in the use of various forms of data analytics for service provision by local government in other areas of government as well has only increased in the last few years. And so we aim in our report to situate our findings in the legal, the social, the practice developments since we did our research. And we aim to make a set of recommendations to other local authorities who are in the same place that this particular local authority was in 2020, who are considering or starting to roll out data analytics. We also have some recommendations, and this links to what Michael was saying earlier around what we think regulators should do to support local authorities. And to the companies who are building these tools. But we've also got some recommendations for civil society who's seeking to hold local authorities accountable for their use of data analytics, and researchers like staff of the Ada Lovelace Institute who are trying to understand more about how these systems work. So we go through to slide 4. So the first big insight, and I think this is ties very well into what Michael was saying around the possibility for sort of results-based programs. We found in our ethnography that there was a real lack of kind of concrete success criteria that were articulated for the different stakeholders in this local authority, and a lack of a strategy for measuring the impact. So how the local authority would decide that this was worth pursuing and worth continuing to spend money and time on. It made it very difficult to assess whether data analytics was delivering any benefits for the local authority. And so what we'd like to see is procurement processes. A number of these systems are being developed by private companies. And we'd like to see the procurement processes from local government to include development of success criteria and how those success will be evaluated or not. And we'd like to see some support from the Crown Commercial Service around things like model contract clauses and an impact assessment standard to help local authorities do this effectively. Go on to the next slide. We also observed the local authorities, despite their best efforts, and we did observe a lot of work towards this, were really struggling to navigate the similarities and differences between special category data under the UK GDPR and protected characteristics data as defined by the Equality Act. And because these bits of legislation and compliance with this legislation are expertise that sits in different teams within a local authority, it makes it quite hard for local authorities to demonstrate compliance with both of these sets of legislation. And so what we'd really like to see is the Information Commissioner's Office to work together to provide guidance for local authorities on how to handle special category data in the use of data analytics, how to handle equalities monitoring, and how to handle equalities monitoring of analytics that uses this special category data. We don't think this is an impossible task, but we think local authorities need more support to help them be able to do this. We can go on to the next slide. And this I think is particularly relevant for the audience here today, which is that introducing a new technical tool, in this case, a data analytics system that used summarizing and predictive analytics, has a real impact on the social parts of the quite complicated system of delivering children's social care in a local authority. Introducing data analytics changes or has the potential to change the relationships both between social workers and other parts of the council, but also between social workers and frontline workers and the residents that they're trying to help. So, for example, we saw social workers who spoke to us during our research saying that they were concerned about how, or not quite sure how to navigate the fact that this data analytics system was giving them more information about an individual or family situation that individual wouldn't necessarily expect the social worker to have, and that this could have an impact on the trust relationship on which social work and the provision of social services depends. And so we would really like to see that if local authorities are deploying these kind of data-driven tools, they need to be evaluated in the context of the whole system into which they're being used, including practitioner experiences and whether or not these systems actually help practitioners to do their job of providing fronts. And, to make this easier, we'd really like to see companies who are developing these kind of systems do so in consultation with the frontline workers so that they understand what the job of being a social worker, being a housing officer, being a frontline worker in a local authority actually entails, and what is needed by these workers to do their jobs well. We could go on to the next slide. Again, thinking about the experiences of practitioners in using these systems, we found that frontline workers were unlikely to be able to rely on or trust outputs from data analytics systems if they didn't know how they were being generated. So if there was a predictive alert generated about a family, if a social worker wasn't sure where that came from or what it was informed by, it was in their day-to-day work. And social workers talked about, for example, they need to be able to explain their work if they were ever part of a serious case review or had to defend their decisions in court. They were unlikely to be able to do this if they were relying on outputs from analytics systems they didn't understand. In the contrary, however, where the underlying logic of an analytics system was clear, this could be quite useful. So I spoke earlier about the fact that we also looked at the use of data analytics to filter people according to COVID risk factors, and where outreach teams understood why a particular person's name appeared on a list of people to contact. So, for example, there's a list of 10 potential risk factors and this person displayed 10 of them according to the data. It was very clear to them why this person was on the list as opposed to somebody else. And they were able to use this information, in this case, identifying residents who were at high risk of COVID, in their work in a way that made them more efficient. And this was not a hugely technical machine learning system. This was the simple use of what data existed to solve a problem that was easily explainable to the frontline workers. And then finally, I'm just going to go on to the last slide. And this links, I think, a little bit to some things that have already been covered, and certainly what came up in the word cloud, which is this idea of ethical frameworks. And we found from our ethnography that ethics has different meanings from different actors. Different people come at it from issues of data ethics, from data protection, from having good intentions, from minimizing bias. There's lots of different things that come under ethics, but as a result, this can result in a number of sort of piecemeal ethical interventions. And again, the council that we looked at was trying very hard to do this ethically, but without a big holistic framework that captured all of the different actors who were using these systems. There's a real risk that ethical interventions can be piecemeal and won't necessarily address all the harms that could happen. I think we're going to take comments at the end, so I'll wrap up there, and thank you very much. And I look forward to hearing your questions.